All right, good afternoon to those on the East Coast. Good morning to the rest of the country. Welcome to everyone who joined for our earlier sessions and to those who are turning in for the first time. This is the fourth session of the Moral Policy in a Time of Crisis conference. This session is titled Securing the Blessings of Liberty, the Right to Health and a Healthy Environment. My name is Noam Sandweiss-Back. I'm with the Kairos Center, and I'll be helping to moderate what promises to be a powerful panel. So as of this morning, there have been more than 223,000 COVID-related deaths in the US. This is an historic emergency, but we cannot forget that before February, the US was already in the throes of a more quiet public health emergency. After all, before COVID-19, this country had the lowest life expectancy, highest chronic disease burden, highest suicide rates, and the highest rate of avoidable deaths amongst wealthy countries. Before COVID-19, over 80 million people in this country were underinsured or uninsured. The cards were stacked against us from day one of the pandemic. Meanwhile, this year charted the hottest September in recorded world history, and we've all witnessed entire regions in this country burning and flooding, while our land, water, and air continues to be poisoned by gas, oil, and other fossil fuel polluting and extractive industries. The health of many millions in this country and the health of the planet itself is under assault, and poor and dispossessed people are being hit first and worst. Death haunts us everywhere. Today, so many of the critical systems in this country are built on the basis of private profit, not human need. These are death-dealing systems that we desperately need to transform, whether our healthcare system, energy system, or the many other systems that have come out throughout this conference. This current crisis should force all of us to deeply consider what the role of government has been in our society and what its role should and could be. And we must also ask what our role can be in charting a new way forward. In the face of mounting suffering, how do we build power to change death-dealing systems into ones that preserve and protect life? We know that we need a mass movement of poor and dispossessed people, and in the Poor People's Campaign, we know that a movement needs a program. We have that in the Jubilee policy platform, a blueprint for the reconstruction of society around the needs of every person, not a wealthy few. So in this session, we're going to look at how we arrived at this moment, the conditions that we're confronting, and how folks are organizing for a genuine vision of health and a healthy environment. This session is being interpreted into Spanish and ASL, which you can access by clicking the closed caption and interpretation buttons at the bottom of the screen. So panelists, please speak clearly and slowly and one person at a time. And for those in the audience, if you have questions, feel free to drop them in by pressing the Q&A button, and we'll work to field as many of them as possible. So lastly, I have the privilege of introducing our incredible panel of organizers, policy experts, and leaders in the movement. When I say your name, panelists, feel free to give a quick wave to the camera. Dr. Shirelle Barber is a scholar activist whose research examines the role of structural racism in shaping health and racial ethnic health inequities among Blacks in the Southern United States and Brazil. Deeply rooted in the rich legacy of Black women radicals from the South, the legacy of activism of her beloved alma mater, Bennett College, and experiences that have taken her to cities across the US and Brazil, Dr. Barber seeks to use empirical research and scholarship to make the invisible visible and mobilize data for action. Michaela Curry is a community organizer, an environmental scientist and poet. She holds advanced degrees in biological sciences and has worked as an environmental scientist, consultant, conservationist, and researcher. She served on the steering committee for Kentuckians for the Commonwealth and has been active in the Poor People's Campaign, a national call for moral revival, since it started in its first season of direct action in 2018. Sharon Levine is a resident of Louisiana who lives and owns property in the predominantly African-American 5th District of St. James Parish, which is heavily pervaded by pipelines and petrochemical facilities, including tank farms. Levine is also founder and president of Rise St. James, a grassroots, faith-based organization dedicated to opposing the siting of new petrochemical facilities in the area out of concern for the worsening health effects and environmental pollution from industry in the area. Basav joins us from the Institute for Policy Study as the Climate Justice Project Director. His work focuses on climate solutions at the national, state, and local level that address racial, economic, gender, and other forms of inequality. Prior to joining IPS, Basav worked for 11 years as a strategic corporate campaign researcher at the United Food and Commercial Workers, UFCW. He also has experience as a campaigner on the World Bank, International Monetary Fund, and global finance and trade issues. Nijmie Dzurinko is a working class, Black, Indigenous, and queer organizer and strategist of over 20 years from Pennsylvania. She is co-founder and co-coordinator on a volunteer basis of Put People First Pennsylvania, a statewide base-building human rights organization waging a healthcare is a human rights campaign. They are also volunteer co-chair of the Pennsylvania Poor People's Campaign and a member of the National Steering Committee of the PPC. Nijmie serves on the executive board of the National Union of the Homeless and is also a member of the University of the Poor and the Popular Education Project. And lastly, Brigitte Kahl is professor of New Testament and Bible at Union Theological Seminary in New York and an ordained minister of the Protestant Church of Berlin-Brandenburg. A native of East Germany, she studied and taught at Humboldt University in Berlin until 1997. She reads the Bible empire critically, as a book of resilience, resistance, and liberation, with a specific focus on Genesis, Luke, and Paul. Poverty, social injustice, racism, sexism, and eco-imperialism are major topics of her work. So welcome, everyone. We'll start with opening comments from each of you, and then we'll get into some discussion together. Sharrelle, we'll start with you.
Thank you so much, Noam. Are the slides available? Perfect. Thank you so much, Noam. I'm so grateful to be here with all of you all and on this really powerful panel. I've been charged with just setting the stage a bit about a couple of things, where we were kind of prior to this COVID-19 pandemic and where we find ourselves today and the different systems that have brought us to this place. And so as Noam alluded to earlier in his comments, prior to this pandemic, there were many in this country that were already in crisis. We had, because of this systemic racism, systemic poverty, and militarism upheld by deadly policies, deadly politics, and ideologies, we had 700 Americans dying each day from poverty before the crisis. There were 14 states that had not expanded Medicaid despite the need in their states. Over 27 million individuals who were uninsured and underinsured. Over 2 million poor and uninsured who fell into the coverage gap, meaning they didn't make enough to be covered by Medicaid, but made more income and were, they made too much and could not be covered by Medicaid, but didn't make enough or were not employed in such a way that they got private insurance. So they fell in what we call the coverage gap. And we know that because of the lack of action on the part of the federal government as well as state governments, over 119 rural hospitals have closed since 2010. And so as you can see, we were really in a point where we were not providing for the poor and dispossessed prior to this pandemic. Next slide, please. And the pandemic really exploited this and exploited the inequities that existed. Again, because of systemic racism, systemic poverty, and militarism, we have created systems and structures to maintain this very deadly hierarchy. And so COVID-19 has exploited what Dr. Mary Bassett calls the fissures of our society, and really has exposed and laid bare the ways in which we have structured society to be extremely deadly. So through exploitive capitalism, we have seen essential workers being forced to work in unhealthy living conditions, not being provided with the proper personal protective equipment, paid sick leave and hazard pay that they need in order to be to be safe and to be healthy. We also know that many have died and put their lives on the line, literally, to keep this economy going, but their lives have been disregarded. We also know that due to segregation in our inner cities and dispossession that indigenous populations have experienced for decades, many live in communities that have structural conditions that are make the amplification of the virus much more. And so in the inner cities like Philadelphia, rates of COVID-19 are 2 times 2 times higher in the most segregated communities compared to the least segregated communities. Again, this is built on a legacy of disinvestment and racism that has existed in these places for so many years. We also have exclusionary immigration system that has left literally thousands upon thousands of individuals invisible. We have left immigrant, both documented and undocumented immigrants, without the access to healthcare and resources that they need to be healthy, again, prior to the pandemic and even during this pandemic. In our jails, in our prisons, in our detention centers, we have created a system of mass incarceration that prior to the pandemic was deadly, but has literally created a petri dish for the virus to propagate. And we have not implemented as of yet systematic policies to protect those who are in prison and those who are in detention centers. So literally the sentences that they have can literally become death sentences in this moment. We have had extractive and polluting industries that have been wreaking havoc on Black, Brown, Indigenous, and poor communities for years. These polluting industries cause higher rates of cancer, higher rates of asthma, some of the underlying chronic conditions that make COVID-19 more deadly among certain populations. And then we have a society that has made the poorest and the most marginalized among us sick, but then refuses to provide the kind of healthcare needed to make them well. And so the lack of free universal healthcare for everyone literally is immoral because again, the structures and the systems that we created make people sick, but we don't provide them with what they need to be well. These are then filtered through what we in social epidemiology call the social and structural determinants of health, which in this crisis have led to differential exposure, transmission, and also differential susceptibility to severe disease and death. And this is what has led to the inequities in COVID-19 morbidity and mortality rates. Next slide, please. If we look just at the kind of racial inequities, and this is just one graph of many graphs of the striking inequities that we've seen, the gaps are huge. In particular, Blacks, Indigenous populations, and Latinx populations experience 3 times the rate of death for COVID-19. There's data from mid-October that says that over 43,000 Blacks have died from COVID-19. That's 20% of the deaths, although Blacks make up 13% of the population. And these, again, striking inequities are not only affecting Blacks, but Indigenous, Pacific Islander, Latino populations as well. One of the things that this graph obscures is not only do Blacks and other marginalized racial groups die at higher rates, but they also die at younger ages. And there's data to suggest that individuals in the age group of 35 to 44 die at a rate that is 9 times higher. Blacks 9 times higher for compared to whites, 8 times higher for Latinos compared to whites, and 8 times higher for Indigenous individuals compared to white, for individuals between the ages of 35 to 44. So early on in this pandemic, people called COVID-19 the great equalizer. But what we are seeing as this pandemic continues to wreak havoc on in our communities, that it is far from an equalizer. It is having a disproportionate impact on marginalized racial groups and the poor. And we as a movement, have a responsibility to respond in this moment and really reimagine a healthcare system and an environment that makes it so that everyone has literally the right to live. Next slide, please. The final thing that I'll say, and I will continue in my lectures and talks, and is to lift up this woman, Pamela Rush, because in mid-June, she became one of the casualties of this exploitive system that disregards life. And our failure in this country, both prior to the pandemic and during the pandemic, to act justly is literally being measured in lives lost. And so the work that we're doing, the work that the policies that need to be implemented are for folks like Pamela Rush from Alabama, who lost her life to COVID-19, but reminds us that it's necessary to fight in this moment for the kinds of life-giving policies that are necessary for all of us to thrive. So thank you for those, the opportunity to provide opening remarks.
Yeah, thank you for that framing, Shirelle. It really is so important for us to recognize that the particular devastation of COVID-19 in this country is in so many ways the product of centuries of what you described, those deadly policies, politics, and ideologies. And yeah, I'm reminded of Pamela Rush, you know, a powerful leader in our movement who we dearly miss, and who before COVID-19 was doing years of organizing in her community, entire neighborhoods flooded with poor sanitation services and the consequences of that. So Basav, want to turn to you next to connect the analysis that Sharrelle just shared with us to the growing climate and environmental crisis. And for folks, a reminder, Basav is the Climate Justice Project Director at the Institute for Policy Studies. So Basav, the floor is yours.
Thank you, Noam, and thank you, Sharrelle, for that beautiful intro. It makes my job easier since you've laid so much of the groundwork. So I'm going to talk about why we don't have a healthy environment, okay? And it does have to do with the systemic forces that Sharrelle named. It should be an obvious point that all human beings need to breathe clean air, not polluted by particulate matter from burning coal. All human beings need to drink clean water, not polluted by wastewater from hydraulic fracking operations to extract oil and gas. All human beings need to eat healthy food, not tainted by toxic pesticides. And all human beings need to live in communities not ravaged by wildfires and hurricanes intensified by climate change. And yet, that's what communities are experiencing. And they're not experiencing this because of some accident. They are experiencing this because powerful forces profit from the continuation of these toxic and polluting industries. Next slide, please. So this year, 2020, as the world was ravaged by the COVID pandemic, I would like to remind people that it's not the only major crisis the world is facing today. Literally, this year, we've had like a raging series of infernos all over the western one-third of this country, from Washington down to California and into Colorado. Colorado is on fire literally right now. And meanwhile, in the Gulf Coast, in Louisiana and Mississippi, Alabama, and down into Texas, we've had not one, but three major hurricanes that have hit that region. And luckily, the direct loss of life from these hurricanes has been relatively low this year. But there have been other forms of damage. For instance, in Lake Charles, Louisiana, uh, toxic polluting petrochemical facilities that are located in Lake Charles. And let me remind people, Lake Charles is a poor, predominantly Black city. These toxic facilities were hit by the hurricane and were spewing pollution, resulting in this public health emergency where people had to shelter in place in their homes in the middle of a hurricane and were unable to evacuate. And so they were given a choice between two different kinds of threats. Either you risk going out to evacuate from the hurricane danger zone and risk getting poisoned, or you stay at home with your windows closed and risk getting flooded in your home and trapped in your home. Uh, and by the way, I would like to remind people that this is not confined to the United States alone. Uh, Earlier this year, during the monsoon season in Bangladesh, literally 1/3 of the entire country was under floodwaters. Next slide, please. So the climate crisis and the crisis of COVID-19 are connected. They're connected in terms of their impacts and in terms of their underlying causes. As Sharrelle mentioned, uh, our polluting and extractive industries like burning fossil fuels uh, not only causes climate change, but also pollutes the air with particulate matter and nitrogen dioxide and other pollutants, which uh, make people more vulnerable to getting ill with COVID and to dying once they get it. And as we saw, climate change intensifies wildfires, which also pollute the air and also have those same respiratory impacts. And again, as Sharrelle pointed out, uh, certain populations, based on race and based on income, are the worst affected by the impacts of air pollution uh, on health. And then there are also commonalities of causes. Just as with the pandemic, there are systemic reasons, uh, going back to the way our society and our economy are structured, which have caused the profoundly unequal impacts we're talking about. Similarly, with the climate crisis, the fact that we are at this stage today uh, is because of similar systemic causes. And the so-called natural disasters of today are not natural disasters. There's nothing natural about the fact that there is so much human misery and suffering. Just as a reminder, 15 years ago during Hurricane Katrina, we saw poor Black people being forced back by law enforcement to drown in a flooded city uh, on the premise that they were suspected to be looters. And so um, protecting property, even if one accepts, and this whole premise of looter is wrong to begin with, but even if one were to assume that a certain person is a looter, the fact that property is valued more than human life has everything to do with why we're seeing the impacts we're seeing today. Next slide, please. So this is what US greenhouse gas emissions have looked like over the last 28 years. And as we see, they rose and rose until 2007. And then the drop since then is partly explained by uh, the severe recession that the economy entered in 2008. And then most recently, we're seeing them going up again. Now, the reason this is significant is that the US government received their first warning about climate change in 1965, okay? And then in 1988, NASA scientist James Hansen delivered very powerful testimony to Congress, essentially saying that we have to start acting right now. We cannot afford to lose a moment. And yet, our elite political interests allowed our emissions to keep rising. Next slide, please. And the reason they allowed it to keep rising, and I'm not going to mince words here, is that certain powerful interests make money off of the, the things that drive climate change. So 20 companies, and I'm naming names here, are responsible for 35% of emissions over a 52-year period. This data is from 1965 to 2017. And 100 companies are responsible for 71% of emissions. And we're seeing, big names here like Saudi Aramco, Chevron, Exxon, BP, etc. Next slide, please. And this is also an international issue. Cumulative emissions of carbon dioxide since the start of the Industrial Revolution. And cumulative emissions matter because carbon dioxide persists in the atmosphere for hundreds of years. So if you look at the cumulative emissions, the rich countries are responsible for an overwhelming majority of it, with the United States alone responsible for a quarter of global emissions. Quarter of global emissions, quarter of worldwide COVID cases, 4% of the world's population. I think it shows something about the kind of society that the United States today is. Next slide, please. And again, pointing to the international impact, the wealthiest 10% of the world's population, their consumption is responsible for more greenhouse gas emissions than literally the remaining 90% of the world's population. So the climate crisis is entirely attributable to our exploitative and unequal global system. Next slide, please. And you don't have to take my word for it. A very staid bunch of global policy wonks, an international UN scientific panel known as the Intergovernmental Panel on Climate Change, said this, what's on the slide, about who is worst affected by climate change. People who are socially, economically, culturally, politically, or otherwise marginalized are especially vulnerable, and their heightened vulnerability is the product of intersecting social processes that result in inequalities, for example, gender, class, race, disability, etc. So even mainstream scientists are acknowledging this, but somehow our so-called elected democratic political leaders are not, and are not taking action at the kind of urgency that is required. And I'm going to leave it at that. Thank you.
Thank you. Yeah, thank you for that, Basav. I think the framing that you and Sharrelle both have offered, really helped to contextualize a bit how we've arrived here in 2020 at the start of a decade that seems to threaten only rising poverty and sickness and rising temperatures as well. So we're going to move next to Mikaela for some opening thoughts. Again, Mikaela is an environmental scientist, an organizer, a poet, has been based out of Kentucky for some time, is now in North Carolina. So Mikaela, you're up.
Hey, thank you. I appreciate being here with y'all today. And everything that's already been shared. Yeah, so I just came back to North Carolina, which is where I grew up, but I've been living in Eastern Kentucky. I've been living in Pike County, which when you drive into Pike County, there's a sign that says America's Energy Capital. As you can see here, these are photos of within an hour of where I lived. The Appalachian Mountains are some of the oldest mountains in the world, and definitely one of the most biologically diverse places in our hemisphere. And if you've been there, you know how beautiful it is. But I wanted to just share these photos with you, just to kind of ground us in place and how powerful and beautiful our world is. You can move to the next slide. So these are also photos taken of within an hour of where I live. The photo on the left of your screen, if you're not familiar with it, might not immediately jump to your attention, but if you see the really flat, grassy tree line in the horizon, that is where a mountain used to be. That's a mountaintop removal site. The photo on the right was a site that was within 10 minutes of where I lived. And there's two pictures side by side. The one on the right is about 8 months before the one on the left. And you can see the mountain just being literally taken away. There's more than 500 Appalachian mountains that have been removed through this process, and about 300 of those are in Eastern Kentucky. 1 million acres in Kentucky have been affected, and over 1,400 miles of streams have been destroyed. I have a 5-year-old. And so one of the things that I did is whenever we would pass this site, I would photograph it. And one day as I was stopped photographing, taking a picture, my child said to me from the back seat, from the car seat, said, "How long will it take this mountain to grow back?" I still can hardly talk about this without crying, because it just never occurred to me, because to me, I knew the weight and the enormity of what this meant. But my child, who knows that if you cut down a tree, you can replant it and it can grow back, thought that the mountains would grow back. And that has just been something that I have carried with me ever since it happened. And then I think about all the time of the responsibility that we have to our children, to other people's children, to the people who are coming after us. And just the violence of these extractive practices and how they are extreme and they are permanent. And also, while these things are permanent, it still matters. I think sometimes we can get caught up in like how overwhelming all of this is, but there is still plenty of mountains to save. There is still much that we can do to turn things around. Can you go to the next slide, please? So here's just kind of a combination of pictures. You can see obviously some, industrial buildings. That is the coal keeps the lights on is a sign that was at a playground where I used to take my child and we'd go walk around. And I think one of the things that's really important to think about and kind of just ground into when we're talking about these things is like all the complexity between what people have been taught and the narratives that have been given to people about the situations and the choices that they have. And the photo in the bottom right is of 5 miners. Last year, a coal company in Kentucky went bankrupt, and they retroactively pulled back the payment to to the people who worked for them out of their bank accounts, which caused people to lose their homes, to not be able to pay their bills. And one person was out riding a 4-wheeler, and they saw the coal company had hired a train to come and pull a last loaded coal train that these workers who had their pay taken from them. And so just 5 of these miners just sat on the track and they said, we're not going to leave here. We're not going to let you take this coal until we've been paid. And it was a long and complex situation, but they stayed on the tracks for 2 months. And a lot of relationships came out of that. There was a lot of complexity around it also. Eventually they did get paid. And I just want to lift that up to say that this was 5 people. And they stopped a train and they got the payment for hundreds of workers. And so I think it's also really important to know that like we individually, what we do matters, and we do each have power. And we do have to intervene at any point that we see. And I think another thing that I'd really like to focus on is just like how much people's perception of the situation that we're in is shaped by the choices that we've been taught, and the idea that the system that we have is the only one that we can have going forward because it's the only one that's affordable. But I just want to raise up that it's not affordable. The public health costs of pollution in Appalachia is $75 billion a year. Not million, billion. And at the same time, in Kentucky, they're paying direct and indirect subsidies to the coal industry that are over $100 million a year. And in the US at large, the direct subsidies to the fossil fuel industry are about $20 billion a year. So it's just completely false, this idea that we have to have the system that we have to have these extractive practices, that we have to cut down mountains and pollute waters and pollute streams in order to be able to function as a society. You can move to the next slide, please. This in the middle is a picture of my child at a Poor People's Campaign, a National Call for Moral Revival event. On the left, you can see a non-polluted stream. And on the right, the like orange water that you see is from acid mine drainage. In Appalachia, about 5.5 million people live within 1 mile of abandoned mine lands. What happens is these companies come in and they extract and they destroy, and then they leave, they declare bankruptcy, they shift, and they don't take accountability for the damages that have occurred. And this is an ongoing issue that there is policy that we can put in place, that there is land, this land can be remediated. Certainly it's better, to prevent these practices from occurring to begin with, but these lands can be remediated. There are practices, but it requires investment, and that requires policies for that. You can go to the next slide. And this is from this past week. The left is a river that's within maybe 2 miles of where my sister lives. And the picture on the right is about 5 miles down the same river. It's a super fun site where there's a bunch of mercury in the soil. People have been exposed. It's an ongoing paper mill. And I guess I just want to say that, I think it's easy, especially when people think about Appalachia, to think of that as the coal industry as something as removed or to itself. But in all of our communities, we are facing pollution. I lived on the Gulf Coast of Florida. I lived in Pensacola, which has the worst city urban drinking water anywhere in the country. Now I'm here in Eastern North Carolina, where there's Gen X in the water, where there's all kinds of pollutants, and it's people, we're familiar with Flint. I think we have to realize that this is happening everywhere. And as Basav said, we all need clean water. We all need clean air. We have to have that for our health. And all of these things are connected. And there is the international impact of consumption. And so I wanted to share this quote from a murdered and assassinated hunter and activist. Our Mother Earth, militarized, fenced in, poisoned, a place where basic rights are systematically violated, demands that we take action. Let us build societies that coexist in a dignified way, in a way that protects life. And I appreciate being part of this conversation today. And I just want to say that it's important to not turn a blind eye and to see what is going on, but it's also, I think, equally important to realize that we have a lot of power and a lot of capacity to change things and to do things in a different way. So that's all for me for right now. Thank you.
Mikaela, thanks. It's really so good to have you with us. And yeah, there's a lot of pain and a lot of power in the pictures and the stories that you just shared, and in the figures and history that Basav and Sharrelle shared as well. And it is true that amidst that pain, folks are getting into step and organizing in new and strategic ways. And in some ways, that's the perfect transition to our next panelist, Sharon Levine, who's the director of Rise St. James, lives in what they call Cancer Alley in Southeast Louisiana. And I used to live in New Orleans, and every time I would drive from New Orleans to Baton Rouge, you pass on the highway smokestacks and buildings spewing out fire and pollution, and you could never imagine that there were also whole communities of people living under the shadow of those industries when you're driving on the highway. But you drive in the back roads, and there are many thousands of people living right there in the shadow of those industries. So yeah, for years, Rise St. James and Sharon has been organizing to stop the polluting of Formosa Plastics, which is a massive multinational plastics company with a factory in their community. And actually just last week, Formosa announced that they're indefinitely pausing construction on a new facility there. So first, I really wanted to congratulate Sharon and all of the folks organizing there on really what is an incredible victory, one that we all need to celebrate and see the significance of in our work. And also, Sharon, just wanted to welcome you. So the floor is yours.
Okay, I'm glad to be with you all today to let you all know what's going on in St. James Parish. I started Rise St. James on October 20th, 2018, when I heard the news that our governor, John Bell Edward, approved a $9.4 billion industry to come into St. James, only 2 miles from my home. And that didn't sit good with me at all. We already bombarded with 12 in the 5th district where I live. We have 9 in the 4th district. We already can't breathe the air. We can't plant a garden anymore because the land is polluted, the water is contaminated, and the air is polluted with toxic chemicals. We didn't know that our land in the 5th district was deemed future industrial. At one time, it was future residential. Our politicians changed the plan in 2014, and we didn't know it was changed. Our present council member tried to change it back to residential, but he only got a part of that done. So now we are stuck. People all over the world look at our little community and think that there is no people that's living here. Then when they come to St. James to see, there are people that's living here. They make deals with the politicians, with the governor, and all of these officials, and they buy land in St. James from the wealthy farmers, and they sell their land for profit. So when we found out about Formosa, that's when we started to fight. No one thought enough of trying to stop this industry. They accepted the fact that the governor and our local officials approved this. So they felt like they didn't have a voice. They felt like it was a done deal. But as I prayed and I talked to my God, and he told me not to sell my home, not to sell my land, and he told me to fight. That's when I formed an organization. I couldn't do it by myself, so I formed an organization, and we call it Rise St. James. We have been having marches to the governor's mansion, to the Capitol. He wouldn't even come out to speak with us. We also had letters sent to the governor. He will not answer our letters. We have asked to meet with him. We have asked to just talk to some of his members in his cabin, that we can solve this problem and let him see that the people in St. James don't want to wind up like Mossville. Mossville is in Lake Charles, Louisiana. They bought them out, and those people had no choice but to move because the industry came in and took over their town. We in St. James Parish, we are not going to let Formosa come in here and run us out of our hometown. This is where we live. This is where we want to stay. We already have people that's dying of cancer and upper respiratory ailments. These people are dying. We didn't know what was going on for years, why so many people was winding up with cancer. I can name a whole list of people that have cancer and have died of cancer. I have 2 members of Rise St. James that died last year. And how many more have to die because of these industries? We have another industry that came in here before I started Rise. I didn't know that our school board members and our politicians had sold our only high school that we had in the 5th district. When it was sold, that's when they called a public meeting to let us know that our school was sold. It was already done. We couldn't stop it. So they're building a plant from China. It's called YCI. They're going to finish with their construction at the end of this year. I pray and ask God to stop this one. I know it might be too late, people tell me, but I don't believe it's too late for God. I believe God can stop this plant. If this plant is built right next to people, people are calling me and asking me, how could we stop this one? I don't know, we're trying. And they had a public hearing and telling us that they want to put their waste, the chemical waste, in our waterways. If the state give them their permit to do this to us, the fishermen will lose their livelihood. The hunters will not be able to hunt anymore because the water will be poisoned. So we're praying that they don't get that permit. If they don't get that permit, they cannot operate that facility. So we the fishermen are alerted. We alerted them about it. I alerted the hunters about it. They didn't know. They didn't know about the public hearing. I just happened to hear about it from other people. And I went and I expressed my opinion. We had about 30 people there at the hearing. One person was for the plant doing this because he worked there, and the rest of the people was opposing it. So it doesn't matter how many people oppose it. When the state says they want to do something, they do it. They have the money, they have the backings of this industry. We are only the little old citizens with nothing to, when it comes down to finances, we don't have the money to fight these industries. But we have attorneys that's on our side that's helping us to fight Formosa. I have about 4 law firms that's helping us. We filed an injunction in July against Formosa, and the judge ruled that they would have to stop construction for 7 months. And then just Monday passed, we heard about them gonna stop construction until after the pandemic. So that's a plus for us, and we're glad because that's a victory for us. And Saturday coming on the 31st of October, we're gonna have a prayer service for All Saints Day. Our bishop from Baton Rouge, Bishop Duca, he's coming to perform the ceremony for us in commemoration of the dead, because they have enslaved grave sites on Formosa's property. So we are going there to honor our ancestors. So that's going to be Saturday coming. And we still plan to have another march. We had a march Saturday opposing the Constitutional Amendment number 5. That was a success. We had about 50 people out there marching with us. And then we plan to have another march at the beginning of December, trying to bring attention to all what's going on in St. James. And we have people that's trying to help us. The community is coming together. They didn't know about these chemicals that's impacting our lives. They thought their loved ones were just getting cancer and getting sick until Rise St. James brought it to the attention of the people in St. James. Our public officials, we asking them to rescind their decision to let Formosa come in here. So we're working on that. And we plan to have on November 1st and November 8th, the Saints, the New Orleans Saints will be playing, and during halftime, we're gonna have a little clip about Formosa. So if you're able to tune into that, we really would appreciate it. And I think that's all for now. Thank you for having me.
Thank you for being with us, Sharon. And I'm reminded of, I think, a meeting we were in together a year ago, and you were up on the stage and you were singing, "Victory is mine, victory is mine. I told Formosa to get thee behind. Victory is mine." And you know, I actually think there's a lot of brilliance in those words, and I'm really reminded in those words that the solutions, the resources are at hand, actually, such that victory could be ours today, not sometime further down the line, somewhere in the future. That actually, what we're demanding in this Jubilee platform, what we're envisioning for a new world, is actually possible right now. And it will take us taking action together, and in the big ways that y'all are doing down there, and in so many of the other ways folks on this panel and folks watching and others are doing around the country. So great to have you with us. We're gonna turn next to Nijmie with Put People First and the Nonviolent Medicaid Army of the Poor. The Nonviolent Medicaid Army just recently wrapped up a powerful week of Medicaid marches around the country. So I think we have a short video from the marches, some photos, and then right after the video, Nijmie, if you wanna take over, that'd be great.
All across the United States this week, we have the Nonviolent Medicaid Army marching up and launching Medicaid marches. Today's Medicaid March is just one of 7 of these actions that are happening across Pennsylvania this week and dozens more across the United States. So from Pittsburgh, PA to Pittsburgh, Kansas, Maine, Alabama, Massachusetts, North Carolina, Wisconsin, and Vermont, the Nonviolent Medicaid Army is strong, and we are here.
Let's go down and march together. Let's go down, do more and more. Nobody there can ever stop us. Let's go down and march out as a poor. Our brothers got to get together. Brothers got to more and more. Nobody there can ever stop us. Let's go down and march out as a poor. Let's go down and march together. Let's go down, do more and more. Nobody there can ever stop us. Let's go down and march out as a poor. As we walk down Jericho Highway, as we walk down side by side, we won't surrender one another to the bandits and the robbers along the Rhine. Oh, let's go down and march together. Let's go down to do more. Nobody there can ever stop us. Let's go down and march out as a poor. We're gonna march through the valleys. We're gonna march long highways too. As we march along together, we'll win back what they stole from me and you. Let's close out. When the road gets rough and rocky, and the hills be steep and high, we'll sing as we go marching, and we'll win our revolution by and by. Let's go down and march together. Let's go down, do more and more. Nobody there can never stop us. Let's go down and march out as a poor.
Awesome. Hopefully y'all can hear me okay. Thank you for another slideshow. My name is Nijmie Dzurinko, calling in today from Philadelphia, Pennsylvania. I'm a lifelong Pennsylvanian. I grew up in Westmoreland County. And I also have really deep ties to North Carolina. Much of my family lives there as well. I really want to thank you all for the opportunity. I want to thank the Kairos Center for the opportunity to be here. And I want to thank Dr. Shirelle, Basav, Mikaela, and Sharon, as well as Noam for organizing this panel and for speaking before me. Everything I've heard so far makes me think about what we need to do to change the situation that we're in and how we can build the power that we need to build in order to do that. We have heard from our amazing panelists the situation. We've heard about some of the organizing that's possible. We've heard that there are a small number of people in comparison to the 140 million that are keeping the system in place and denying us our rights, poisoning us, poisoning our land, poisoning our water, denying us healthcare, housing, and everything else that we need. And so my work relates to how do we come together and build clear, competent, committed, and connected leaders who can have an accurate diagnosis of the problem so that we can create the right prescription. And the Nonviolent Medicaid Army, which I'm talking about today, emerged from our analysis. Care is a very unifying issue for the poor and dispossessed. And it also connects to all of what we're talking about here today, from the crisis of environmental devastation, those impacts on the health of the planet and the health of human beings. It connects to poverty, systemic racism. So healthcare and health is a through line through all the issues that we're talking about today. And in a place like Pennsylvania, where I organize, where there's 67 counties and 13 million people, we have a really enormous task of uniting the poor and dispossessed across lines of division. And health and healthcare, as the Poor People's the Jubilee platform, and learning about the concerns of low-income, poor and low-income voters, health and healthcare is one of the top issues for folks, the top concerns. The Nonviolent Medicaid Army is modeled after the Nonviolent Army of the Poor that Dr. King talked about in the original Poor People's Campaign. And it emerges out of our strategic analysis that those who are on or excluded from Medicaid represent the totality of the working class in all of our diversity. So Medicaid and the Nonviolent Medicaid Army becomes a lens through which to understand the working class and how we're impacted by all of these issues. And it becomes a rallying point for our class. And I think we can see this, the struggle for Medicaid, to strengthen it, to expand it, for no cuts or hoops or exclusions, unites the North and the South of the US. And the struggle for healthcare unites the global working class. Healthcare is an international issue. And what we saw during the week of action, we held Medicaid marches the week of September 28th, inspired originally by the Medicaid marches of the Vermont Workers Center, with 13 states participating, taking part in the process, including Alabama. As you heard on the slideshow, Brianne said, from Pittsburgh, Kansas to Pittsburgh, Pennsylvania, Wisconsin, North Carolina, Pennsylvania, and many other places, Vermont. We were able to make the invisible visible. We were able to get beneath the surface of things to show the connections between the state violence hospital closings, of the denial of health care, and the state violence of police violence, the state violence of police murder. There's a connection when over a quarter of those murdered by the police are in mental health crisis. We were able to lift up in Lancaster, Pennsylvania, the closure of a hospital by the University of Pittsburgh Medical Center. And just shortly before the marches, there was another murder of a Black and Latinx man in mental health crisis. And the most progressive city council that they've ever had in that town had just voted unanimously to rezone the closed hospital for real estate, just about a week before Ricardo Munoz was killed by the police. So there's a connection between these things. They're not separate issues, and the Nonviolent Medicaid Army is lifting that up. Workers like Ashani Gaston in North Carolina, with the Raise Up for 15, spoke about the connection between worker rights and healthcare. People like Abigail Cruz from Madison, Wisconsin, spoke about the fact that many undocumented folks felt that citizens had the right to healthcare, that folks who were citizens had everything they needed, and being part of the Medicaid March taught her, showed her that actually that wasn't true. It was the first time she got a glimpse of the commonality actually shared by undocumented folks and citizens in the fight for healthcare. And the Nonviolent Medicaid Army is able to center the fight for healthcare as a human right with the poor and dispossessed as the leading force, which is something that we very much need to do. Need to unite and organize the 140 million people, poor and dispossessed people in this country that we talk about in the Poor People's Campaign, a national call for moral revival. Nonviolent Medicaid Army, along with the National Union of the Homeless and many other motions, are part of this organizing drive to unite the poor and dispossessed across all lines of division and to build clear, competent, committed, and connected leaders. You can find out more at nonviolentmedicaidarmy.org. Thank you, Sharon, for posting that in the chat. And I'll also post a recent video that we made of the week of marches across the country. And once again, I just really thank you for the opportunity to be here and appreciate everyone here, all the panelists and all the attendees for everything that you do. Thank you.
Yeah, Nijmie, thank you as always for your clarity. And the work of the Nonviolent Medicaid Army is a really significant and strategic development in the building up of the unity of poor and dispossessed people. So folks should definitely check out the links in the chat, both the website and the video that Nijmie just pasted. So before we open up for a little bit of wider discussion, we're just going to hear from Brigitte Kahl, our last panelist, who's a professor of New Testament and the Bible at Union Theological Seminary in New York. You know, we can't forget that as we're fighting for our health and for a healthy environment, we're fighting on the mental and the moral terrain, and you know, even a theological terrain in this country, and for so many of us. And so Brigitte, I'm guessing that the other panelists and the words that they've shared have provoked some thoughts for you on that front. So I wanted to hand it off to you and go from there.
Yeah, thank you. Thank you very much. I'm very grateful I can be this morning here with you all, with the people in the panel, but also with you out there who are joining us, and because you think these things simply matter. I thought I knew a lot about all these things, but listening to Sharrelle and to Basav and to Mikaela, it makes things so much more urgent. It is so disturbing, but it is also encouraging to hear and to be with you together in this. And you know, I was, when I listened to Sharon's story, I thought, you know, this is actually, it's not just a story. It is a story we all need to hear. And it is actually a sacred story. It is part of the big storybook of sacred stories that we call the Bible. It is just another version. It is a contemporary version that we also can read in the Bible. And this morning, I just understand myself as a storyteller. So I want to start with a story, a Bible story. There once was a big king, and this king had a dream that he couldn't get over. He couldn't get rid of it. It was worrisome. It was actually a nightmare. What he saw in his dream was a very big statue, a colossus. It was made of different metals, the head of gold, the chest and the arms of silver. Further down around the belly, there was bronze, and the legs were iron. But the feet, curiously, were a mixture of a bit of iron and just clay, dirt. I always found it puzzling to picture that statue in the book of Daniel, chapter 2. There's nothing surprising, actually, about a fancy play toy of imperial power that is made of gold and silver, or even bronze and iron further down. But who in their right mind would make such a statue with feet from clay, just dirt? Even if you fortify it with a bit of iron, it can't hold the whole thing up. It will topple inevitably. We know that, do we? Perhaps we have to ask differently. Who in their right mind would make a statue with a big fat head and probably also a big fat crown on it, all of solid gold, sitting on a silver trunk? No wonder if you spend or make all your money at the top, there's nothing left at the bottom. Not enough trickling down to build a sustainable foundation. It is a very unhealthy statue, actually, but it still looks good to a lot of people. Or perhaps the statue builder just forgot to think about the feet. It seemed such a trivial thing after he had made this glorious head, a huge shiny orb of gold sparkling in the sun that attracts everybody's gaze and attention. And you simply notice no longer what is happening on the ground, where people go without food or housing or healthcare or having living conditions like non-toxic water or uncontaminated air or soil. So if property, this was what Basav says, if property and wealth counts more than health and life, then we end up with building these statues and worshiping them. But maybe the statue that is so deeply and structurally flawed from the outset is Earth striking back. Mikaela said, Earth demands taking action. Maybe in this statue, Earth already has started to take action. You know that gold, silver, and bronze, also iron, are all produced by an extractivist and exploitative and polluting economy that treats Earth as nothing else than a provider of natural resources, a provider that you can brutally exploit and endlessly exploit. And then in the end, you can use it after it has provided you all these precious metals, rare earths, oil, fossil fuels, and all that, after that, it becomes just the big dumping site of all our waste. You know, and I think as Christians, we have to take responsibility here, because Christianity has often treated earth and nature and natural environment just as a dumping ground, as inferior, as something we don't need to care about as Christians, because we will get something better in the end, namely heaven. Now I have to warn you, heavenism is not what the Bible teaches. We don't get a replacement earth like the next and more advanced version of a cell phone that we can just throw away after the old one is gone. This is not what the Bible promises us. So we cannot destroy earth with impunity, expecting we will get a spare earth. But let us get back to our story. The statue of the king, the statue the king sees looks golden, but it is not only made from earth, but also from the labor and lifeblood of countless people working in the mines, often without seeing the light of the day for weeks. That is already there in antiquity. And I was just reminded of that when Mikaela talked about mountaintop removal. So mountaintop removal is not a modern invention. The Romans already did it and called it ruina montium, ruin of the mountains. They extracted gold by digging deep, deep tunnels into the mountain and then pushing water into them from huge reservoirs that they had built. And the water created a vacuum that made the mountain collapse, burying many of the underground laborers, but pushing out the gold water to the surface that then was filtered to collect the gold out of it. In Las Medullas in Spain, you can still see what this produced still today. It's a UNESCO World Heritage Site today. But you know, I was reminded of that, but because this site looks exactly like Appalachia looks. And you know, it still looks like that after 2,000 years. So it has, the mountains have not recovered from this ecological disaster called Roman Empire. And the mountains and people in Appalachia will not recover for a long time from what capitalist greed did to them either. But there is hope in our story. And that is the best thing, because there was a lot of hope also in what we heard this morning. The hope, of course, is the nightmare of the king. For there is a little stone, a tiny piece of rock that comes rolling along right towards the feet of the clay statue. No, towards the clay feet of the statue. And the dirt of which the feet of the statue are made happily leaves its forced union with the iron and embraces the rock. And all of a sudden, the statue has no more feet and falls down and scatters into a million pieces. You know, you could just imagine the feet are walking away from under the statue. It is what we call building a movement. You know, people marching, people on the road, people moving away from the Colossus and leaving it behind. So this is about change, and this change starts from the bottom. But the bottom has to understand its power, and we have seen this power here this morning. People who are treated like dirt, and the dirt of the earth itself are rising up against the Colossus. And I think we are at such a Kairos moment right now. You know, COVID has done terrible things, and it has taken a terrible toll again from the poor and the people on the margins. And I'm glad we heard about Pamela Rush. But you know, if this is meant to make sense to us, we have to take it as a Kairos movement and understand that this tiny virus, with all the terrible things it did, it stopped the Colossus for a while. And the Colossus can be stopped. It can be toppled. So the system that is built on destroying people and the planet is not infallible. It can be changed. But the people on the margins have to do it. And I think theologically, this is the most important faith act that we need right now. Trust that change is possible. Not just necessary, but also possible. And that the end of capitalism is not the end of the world. So this is what what I take away from this morning. We can topple the Colossus. And if we don't topple it, however, it will bury us underneath it. So we better get moving. Thank you.
Amen to that. Thanks for taking us to Bible study and school and a history lesson all at once. And I think we can all imagine, or don't need to imagine, what that Colossus looks like today. And we do need to get clear on who that king is, and the nightmare that he's dreaming up, in some ways, is us rising up together. You know, this reminds me a little bit actually of the principles of the Jubilee platform. There are 5 principles that the platform is grounded in, and in some ways, all of what we've just heard is encapsulated in those principles. The first of which is we need a moral revolution of values to repair the breach in our society. The second is everybody in, nobody out. The third, very resonant to what Brigitte just put out, is when you lift from the bottom, everybody rises. The fourth is prioritize the leadership of the poor, low income, and most impacted. And the fifth is debts that cannot be paid must be relieved. So we have just about 10 minutes for a little bit of discussion and Q&A. I have some questions. I see some folks have dropped some questions in the chat, but before I put any of that out there, I was just curious if any of the other panelists felt inspired by any of the words that Brigitte just put out, want to respond to those principles in the Jubilee platform. Yeah, does anyone have thoughts on either of those? Well, maybe I'll put a question out there, and then we can go from there. So, you know, I was just thinking a little bit about how it really does feel like the political discourse in our country seems to just be getting smaller and more anemic every day. And at the same time, as Nijmie was saying, we're seeing a whole sea change in public opinion on issues like healthcare and the environment. You know, more and more people are talking about things like Medicare for all and the Green New Deal. And in the Jubilee platform, we have a really expansive set of policy solutions. And we also start with issues that are often overlooked, even, you know, by progressives. Key issues like the right to water, and as Nijmie was putting out, the struggle for Medicaid expansion. You know, these kind of key issues of poor folks around the country. So maybe Nijmie or Sharrelle or Basav or Sharon, curious, you know, I want to ask, you know, why in a conference called Moral Policy in a Time of Crisis, we have to start from the vantage point of the struggles of poor and of the poor and most impacted. maybe Nijmie, I'll throw that to you first.
Thanks, Noam. You're asking why do we have to start from the 140 million?
Yeah, exactly.
Sure. I think that one of the things we try very much to emphasize in the organizing among the work we do here in Pennsylvania and in all of the other states, and I know in the Poor People's Campaign more broadly, is that this isn't about what's in the interests of the 140 million is only in the interests of the 140 million. What's in the interests of 140 million is in the interest of the whole society. When we have a pandemic like COVID and we don't have healthcare, no one is safe. No one is separated from that pandemic. When we have a global economic crisis and our housing is very fragile and we're one paycheck away from being homeless, almost no one other than those who rule are actually exempt from that situation. So what is in the interest of the 140 million is in the interest of the whole society. And the 140 million, the poor and dispossessed, are the most ready to move, to change society. But that doesn't mean that they only benefit, they're the only ones who benefit from a change. It's actually everyone who does benefit. So I think that the focus on the poor and dispossessed is about building that new and unsettling force that Dr. King talked about, that unsettles the whole society. But we need to build that force in order to be able to unsettle everyone else, and that our interests are in the interests of the whole society.
Yeah, Sharrelle, I saw your head nodding throughout that, and curious if you have anything to add.
Well, I mean, I think Nijmie has just said it very, very, very beautifully and upfront. This pandemic, the committee and I have been talking about this, from the very beginning. The extent to which we don't deal with the pandemic among the most marginalized means we don't deal with the pandemic, but that applies to so many things. The extent to which we don't deal with poverty, with racism, with all of these interlocking injustices means we don't, deal with the wounds that have been, caused by our society. And I'm just reminded of a phrase that I learned in my work in Brazil from a Black queer politician, Marielle Franco, that outlived here. "You so porque no somos," I am because we are. And in this moment, I think we have to recognize that just our interconnectedness, and that we are all in this together, and we have to see the humanity and the dignity in everyone. And so I think that's, and I love that Brigitte talked about this as a Kairos moment, that the Kairos Center centers these moments, because it is. We have a choice. This pandemic has showed us who we are, but we can choose to be different. And I think this is a moment, and I'm almost in tears here because it has been just so powerful to hear the resilience and the resistance despite the devastation that we are all experiencing. And this is beautiful. And everyone just has to get in step, and it's just been a powerful morning. So that's all I'll add.
Thanks, Sharrelle. And it is true that in a lot of ways this is just a teaser. This is a commercial for the kind of discussion and debate, analysis, and study that we need to continue to do together. And there are more comments in the chat and more questions in the Q&A function. And I've got more questions, but it's 1:25 and we're about at time. And so I do think it was really worth, allowing everyone to just dig in a little deeper into these presentations and stories. And this has just been such a rich conversation, and agreed, Sharrelle, really grateful for what everyone's brought to the conversation. Yesterday, Reverend William Barber helped open up the conference, and he reminded us that a real reconstruction of society is not just about changing individual policies, but about changing who gets to make policy and for who. And the stakes of such a reconstruction just couldn't be higher today. And as everyone on the panel has reminded us, our health and the health of our planet are under constant attack, even though the resources and the solutions are at hand to make human and environmental health the law of the land. But within these miserable conditions, there are also really the seeds for change, and the heroic struggles that are represented by folks on this panel, from healthcare to the fight against polluting industries, will only over the coming years become greater rallying and organizing points, as Nijmie was saying, for the poor and the increasing numbers of other folks who are being awakened to a new kind of precarity. So to close us out, Mikaela, who, along with being a badass environmental scientist and community organizer, is also a poet. So she's going to share a poem with us before we leave. After Mikaela, we'll transition out with another music video of Everybody's Got a Right to Live, this one by the musicians Sani Singh, Ernest Stewart, Jean Rowe, and Rowan Kimani. And then we'll take an hour-long break before our next session at 2:30 p.m. Eastern Time, where we'll be discussing the constitutional principle of common defense and how we reprioritize our national resources. It'll really be worth sticking around for. I want to thank everyone on this conference that y'all can't see who helped to make this session possible. Paige and Nick and Leanne and Anna and Shally and Heather and so many others. So thank you, thank you, thank you. I'll stop talking now, and Mikaela, the floor is yours.
Okay, thank you. This is the first time I'm reading this. I wrote this for today. So here is water, but don't drink it. Maybe try not to even think it. It creeps within us and beyond us, in our bodies and our wells, in our futures and our cells. The cost is our lives as they sell us lies. This isn't the only way. This is just how they are getting paid. What we do to the land, we do to each other. Disconnected from relationships, watch all the ways power will call us other to keep us from calling ourselves sisters and brother. The scars of this country are wounds, not healed, closed and festering, while their narratives keep lecturing on economies and measuring the numbers of their wealth, while people pay the price with their lives and their health. Here is water within us, moving, rising. It's not surprising the crisis seen coming, pushed aside for the constant accommodation of capital, the narrative that it's only practical to use people and nature as obstacles, commodities, or political opportunities, isolating us from our own communities, push us apart into silence and false competition, so we are distracted from our mission, which is to gather into action, look at how to heal, how to care. We can have what is right. We can have what is fair. But it's not even enough to be in alignment, to understand the crisis, the climate, this turbulent empire, reliant on catastrophe and distress, to dispossess us, to oppress us and repress us, while they name it progress. It's not just the crumbling infrastructure and all the ways it ruptures, it's the teeth marks on our lives. The way something can scrape even when it's gone. It's the forests that are not disappearing, they are being stolen, are being raped, while the waters flood, fires rage, the earth quakes, desecrated, molested, and sold, cut down and replaced by imitations of itself, a caricature of the world we can have. But without the rooted complexity of soil, of relationships, of interwoven understanding, everything washes away. The flooding comes again and again. Remnants of life, torn flags of surrender in the bare branches along the edges of everywhere. The bodies under the pipeline road, the slow trickle death. Here's water, don't drink it. Maybe try not to even think it. How can you when there's holes in the ceilings, the neighbors are being evicted, the foundations are shaking, everything is breaking, enabled by exploitative lawmaking. But also when silence is betrayal, we know we can't be silent. But it's beyond our words, all this violence. It's where we put our bodies. It's the silence from our bodies. Watch the bodies who are forced out of their bodies. Our bodies, the cost of our health constantly measured against the hoarding of wealth. The cost of this extractive war economy is death. Structural reasoning cannot bargain this away with some new jargon, but here we are called an apocalyptic jubilee. It is beyond you. It is beyond me, but no one else is coming to do this for us. Here's the water, don't drink it. Here's the future for my child. Here are some places someone might call wild. Here's the pleasure of sweet air, the relief of breaths without choking, of systems repaired beyond voting. Here is the mountain which will not grow back. Here is the absence of too many things. The violent erasure of what's still tending, what can start healing, what can be mending, but not while the steep blade of this apparatus keeps cutting away, keeps the arrangement of destruction and production as if this is the inevitable conclusion instead of what it is, a violent strategy of delusion and confusion and arrangement of false solutions. This great chain of being undermines our potential. The hierarchy seeped into the mundane, the violent campaign to maintain and grow power imbalances, fed by the lie of scarcity, the warfare of disparity to concentrate power. These lies are loud, but we can be louder. Intervention is a practice in interruption, and from us all, care and co-creation, building power for transformation, for regeneration, for liberation without alienation, for principled struggle against structures that fight anything smoldering requires constant ignition. Let us continue our friction into spark, into burning. We are the voices. We are the choir. We are the flame. We are the fire. We have the truth of abundance, of enough, of each other. Hear the jubilation of the future that is waiting. Thank y'all.
Thank you, Michaela. No words, only love. We'll see you all in an hour.